So hello to all the viewers. I've got Dr. Sreehari with me. So very dear student, and just a few minutes back, we had the announcement of the results of INI SS DM Neurology entrance examination for the November 2025 exam. And with me, I've got number one, rank one for AIMS merit list and common merit list. Hearty congratulations, Sreehari.
Thank you very much, sir. I'm very grateful to have had guidance from you while preparing.
Right. So, Srihari, I'm so happy to see you secure this outstanding achievement. And I think the viewers will want to know more about the journey that you had, and how you prepared, because a lot of them would be aspiring to get into central institutes. Some of them, might have missed out during their PG days, but, they might be wanting to get into a central institute. So I think your insights will be very valuable for them. So before we begin asking you more questions about your preparation journey, can you just tell a bit about your background? You're from which place? You did your MBBS and then subsequently post graduation from which all colleges?
Uh, Sir, I am from Kerala. And before introducing about myself, I would like to thank the people around me who have made this possible. My parents and my wife, Dr. Amrita Varshini, and my mother-in-law, father-in-law, and my uncle. We live as a joint family here. So
Right.
this entire support system was the pillar behind my success. Like without them, I couldn't have imagined of even cracking this exam, let alone this rank. So and because one thing was my wife Dr. Amrita had recently cracked this exam, so even before starting I had an understanding of what I would expect in this exam, what are the important topics, and the interview also. All of that, I had someone to always guide me throughout the day when I'm reading. So all of these things, I am blessed to have people around me who have made this possible. And no doubt, sir, without your videos also, again, this wouldn't have been possible, because we can just keep on reading neurology. It's such a vast subject, but we need to know in the limited amount of time where to focus on and what are the high yield areas. So I'm so grateful to have learned from you, and that made this possible, sir. I did my MBBS from Maulana Azad Medical College, Delhi, sir, in 2014. There I had the fortune of having so many friends who supported me throughout, and they used to tell me that you should, whatever you believe inside, you have to chase this. Not like at the same time there were so many overachievers, but at the same time when I took a step back to remain back in general medicine for a long time, I had people who believed in me throughout my UG and PG, and that helped me learn the subject a lot. Then I did a post graduation in AIMS Raipur. I was fortunate to have a wonderful batch of co-PGs. Many of them are specialists right now. They are in gastroenterology, neurology, so nephrology. So Dr. Sunil in nephrology, Dr. Najia, she was earlier preparing and is doing in NIMHANS
Yeah,
neurology.
yeah, yeah. I know
So
Najia. He was our student
yes.
only. Right.
Yes, and Dr. Abhishek in gastro, Dr. Chandrapriyan in gastro. All of them were guiding me with respect to neurology and even the general medicine. What are the high yield topics? I used to talk to my friends all the time, and my
Right.
best friend in PG, Dr. Ashok, who is doing who is doing just surgical gastroenterology. And beyond doubt, I had wonderful seniors, consultants, and juniors in AIMS Raipur, followed by JIPMER when I did my a senior residency in medicine,
Okay.
and non-academic senior residency in neurology in JIPMER. I have been working in JIPMER for 15 months. All of that together made this possible, because I feel like we are defined as by the institute and people around us who uh, we interact with more than us. Like all of the people who motivated me to aspire and work hard, they are real reason for my success.
Right. And I'm so happy, and you have got a good support system. And I should also make a mention of Dr. Amrita. She was also a brilliant student. She also got a top rank for the Central Institute examination. I think rank two, if I'm not
Yes,
mistaken. Rank
and
two.
yes,
Okay, and you've got rank one. So it's a family of toppers, I should say. But above that, I think she's also a wonderful human being. And
yes,
I had a talk with her, I think a couple of months back, regarding helping one of my students make her choice for the post
yes,
graduation medicine, and I
Yes.
just requested Amrita if you can just talk to that particular student, and she was very much open to that, and I'm so glad for that. Okay.
Honestly, I feel like rank one is mine and Amrita's rank. So
All
rank two
right.
was Amrita's rank. It's
That's
just an upgrade by both of us.
That's great. That's good.
Yes.
And yeah, so happy for that. And Srihari, coming to your preparation journey, and as you just said a while back, neurology is a vast subject, and at least certain topics, though may be factual, you have got good level of understanding, especially with regards to clinical neurology in certain other topics as well. So, how useful were the doc tutorials videos in shaping up your concepts on such areas?
Sir, doc tutorial, I honestly feel like if there's a difficult concept in neurology, for example, dystonia, myoclonus, all of these are something we are not exposed to as general medicine residents. So I felt like you dissect out this topic so well that after the video, I can remember this very well. And at the same time, I can understand actually what is happening, because suddenly in myoclonus, I am thrown new names like Lafora body disease and all. I'm suddenly scared what is happening. But your videos were so, it starts from a basic level. You don't assume us to be people who are specialized, preparing for the specialist entrance exam. You assume our level to be starting with general medicine, and you start from there. That is the beauty of the videos, in which I can, and whatever topic I have so much difficulty in, after the video I felt so much better.
And when you prepare for such competitive entrance exams, I think MCQ practice should be looked upon, because otherwise, sometimes what can happen is you might have difficulty in dealing with the questions. So what I want to ask you is, how useful was the preparation tool of doc tutorials with regards to the Q bank as well as the grant test, in your journey?
That is true, sir. Like, we can keep reading, but ultimately, what we are reading for is the real exam. So we have to keep testing ourselves. And there are, so I felt like I would grant test personally. I always gave a priority over the Q bank, because grant test has that unpredictability factor, just like the exam is. So it will throw you all the general medicine questions in between, and even neurology, you cannot think what topic it will come from. So I used to start from the doc tutorial grant tests first, and that gave me a good analysis of what topics I am weak in, and which questions I am going wrong with. And then from there, if I felt like there is a particular topic like movement disorder in which so many questions are going wrong, then I used to go back and then do the Q bank of that topic. So that my strategy used to be that way.
Right. And now coming to the recall videos. Now for INI, what I always believe is, if you are targeting INI, you have got to have a stronghold in the INI previous year topics. And for that, I think recall videos are very important. So I've done recall videos of last several years in the app, and I just want to ask you, like, how useful were the doc tutorials, previous year question discussion videos, the recall videos in your exam preparation?
So I cannot imagine this rank without general medicine and neurology recall videos. Honestly, I cannot imagine this rank, because they do repeat topics so much. And I had gone through your recall videos with priority. That was my priority among the video bank, was the recall videos, because of how AIMS had repeated this in the actual exam also. Even if they don't, they do repeat the questions also, but even if they don't repeat the questions, but the previous year options will also show up suddenly if, this thing, like if they had asked something on shrimp sign, then shrimp sign will be one of the options also. Question may be something different. So if you will be comfortable because you had read that in the previous year questions, otherwise suddenly you will think like, what is this option, and it might hinder your speed during the exam. It was definitely an exam which went until the last minute. I didn't have time to sit up and analyze this. So these things definitely speed up. And even general medicine, I'll honestly say general medicine recall videos are also there in doc tutorials, and general medicine is repeating like anything, two or three questions. I think like easily they repeated the exact same question from general medicine recalls.
Right. So I think I also stress on the same point. I think it's very important to have a good knowledge about those previous year topics. So just to clarify that a bit further, we have done the recall videos, I think, from, I think, in the year 2021. Have you gone through all the recall videos?
Yes, sir. I've gone through all the recall videos and I've noted all those sweet questions down, and I've gone through again and again. I kept revising those questions again and again.
So I just want to see how your mind works. Actually, did you give a special emphasis on those topics? Like, a particular question was asked on this epilepsy syndrome. Okay, this is a high yield topic, so I should not miss out on a question on that. Is it like that? Was it your thought like that?
That is true, sir. Whenever I used to revise, I used to decide which topics to revise on. So recall videos help me realize that epileptic encephalopathy is a very important topic, and that is some topic which requires frequent revision. Beyond that, we cannot do, because epileptic encephalopathy is not something that you will be exposed to as a resident. Like, honestly, I have done non-academic senior residency in JIPMER neurology. Being in Chipman neurology also, I haven't had seen all the cases of epileptic encephalopathy. So this is a topic which is purely theory based.
Right.
So due to that, there are certain topics which I can figure out from the recalls that they are frequently repeated, and unless they are repeatedly revised, there is no way of scoring a good rank, because as frequently repeated topics is something everyone would focus on, and as not scoring in those areas will be uh, later on you will regret that.
Right.
So epileptic encephalopathy is one area which I realized I have to really focus on, and it paid off also, because they actually tested a really difficult question in which they had asked that, what medication is not used in uh, I think it was Dravet syndrome. I think they asked about Dravet syndrome, which medication is not used, and they
Yeah.
give all these newer anti-epileptics. And then,
Right.
unless I had revised that, I couldn't have done that.
Right. And Srihari, now going to the second round of the INI, because you have got AML rank one. So whatever score you actually got in the first round, you could actually keep at par with that performance in the second round as well. So just want to ask you, uh, regarding the INI round two preparation, how useful were the doc tutorials resources like the mock interview sessions?
Sir, my interview performance is completely due to the interview recall videos that I had seen, because there is an unpredictability factor. We don't know who are asking, what are their areas of interest, and you had done so much research over the years and made so many videos that I just had to go through these videos, and then I understood how to approach this subject. Because one thing is about reading for the 80 marks, but then interview, it suddenly becomes completely different. The entire point of view of every topic becomes different, because they will want us to frame answer in a way that the common differentials are put first, and the rare differentials we should not mention easily. Otherwise, they would assume like we don't have a practical knowledge or haven't seen patients. And also, when seeing MRI, like you had told, not to jump to a diagnosis or a named sign, but rather start by describing MRI, so that they know that when seeing MRI, we won't be biased and suddenly jump to a diagnosis. So all of these things in interview, it helped me so much, because I felt like in interview the entire preparation had to be again geared up in another way, redefined, and again that preparation should have been should always be in a different way than the MCQ. You had stressed on the fact not to go and revise again just like we had read for the MCQ exam. So not to keep revising the same thing, but rather to focus on their favorite topics and be fluent in those.
And this is for the viewers, who are preparing for the INI, upcoming INI. So one message that I have understood from Srihari is that, neurology is a vast subject, but when he was preparing for that exam, it was a sort of targeted approach. Yes, he was, doing the subject, but he understood the importance of previous year topics in round one. So though he learned all topics, he gave some extra emphasis to the previous year topics. That is number one. Number two, when he prepared for the interview round, he understood the pattern of questions being asked for the interview. So he gave emphasis, and I suppose for the interview, he was giving sole emphasis on the previous year, topics. So am I right in that, Srihari?
True, sir. And I feel like one point is not to go back to the past and think like in this CML exam in the 80 questions, should I have done this? Should I have done that? Even not think that will I be qualified for the interview, not keep any thought, because I feel like if someone is preparing for neurology, they are sure that they want neurology. They are irrespective, they are going to read the next time also for neurology, even if they are not qualifying. I feel like after the CML exam, you have to sit and in 1 or 2 days, you have to start preparing for interview and not look back at the previous exam. That is a very important, that 80 questions you don't have a weight, have a power to change anything about it. So rather you have to think that interview is like 20 questions, 20 marks means it is 20 questions. So rather than thinking or crying about 1 or 2 questions which you had made wrong, you have an opportunity to score in 20 you have 20 empty questions, a slot of 20 empty questions in front of you, and making a difference in that will elevate your rank by so many points.
And also, about the question collection that I have shared with you in the group, did seeing those questions at least, relieve the pressure? Because otherwise, you would be attending the exam not exactly knowing what to expect. So did the number of questions actually help you understand, okay, this is what is being asked, or was it overwhelming to see all the questions?
Wasn't actually, it wasn't overwhelming, so honestly what I did is, before starting to solve all these questions, I categorize these questions into their own topics, which is from movement disorder, which is from stroke. So I realized that stroke is one of the highest yield area, then epilepsy is a very high yield area, and then I realized that so many topics like embryology will not be even asked. So there is no point of sitting and preparing embryology questions, that is just for the 80 mark paper. So that helped me a lot in realizing that the most number of questions which may come will be from stroke and epilepsy, so focus on that the most. Again, look
Right.
at EG from a different way. In the first 80 questions, when you are solving, you just need to make a mental picture of what you will see in the EG, which you need not explain to anyone, and you can easily solve those. But when you are approaching an EG for interview, they will expect you to start from describing what kind of an EG it is the background normal. So they would like you to prove what the diagnosis is. In an 80 mark question, you don't need to prove what the diagnosis. With some clues you have in your mind, you can immediately jump to the answer.
Right. And I also want to just tell you that, when the results were announced, I'm again so happy that you had that courtesy to give a call and share your results with me, because I was excited, hearing your rank, maybe much more than you were. That's what I would say.
Sir, this rank is so the reason for this rank is sitting in front of me. So there's no beyond doubt, the first person to call was you only.
Right. Thank you so much. That was, very, very heartwarming call that I actually received, and this actually made my day as well. Thank you so much, Srihari, and I'm
Thank you.
really happy for your achievement, and wish you good luck for future as well. Thank you so
Thank
much.
you very much. Thank you, sir.